New outbreaks are once again making headlines.
The center of the deadly hantavirus outbreak.
Declared a global health emergency due to the rapid spread of Ebola virus.
Health officials are monitoring hantavirus cases in the United States, while Ebola outbreaks in parts of Africa have raised concerns about regional spread. Neither is expected to become another pandemic.
The risk of hantavirus to the general public remains very, very low.
But they are reminders that infectious disease outbreaks still have the potential to disrupt economies, markets, and daily life. And history shows they often do. The Black Death in the 1300s killed an estimated 1/3 of Europe's population. Labor became scarce, wages rose, and economic power slowly shifted away from feudal land systems toward workers. But the economic disruption didn't end there. Plague outbreaks kept returning for centuries, repeatedly shrinking populations and keeping labor tight, which continued to reshape Europe's economic structure over time. In 1720, the plague reached Marseille in one of Europe's last major outbreaks. Trade in the region was disrupted, ports were shut down, and quarantine systems slowed commerce across the Mediterranean. It was an early example of public health measures directly impacting trade and economic activity. In the 1800s, multiple cholera pandemics spread globally. Rapid urbanization helped the disease move through cities and shipping routes. The economic impact wasn't just lost productivity. Governments were forced to invest heavily in sanitation systems like clean water and sewage infrastructure, marking one of the earliest links between pandemics and long-term public investment. In 1889, the so-called Russian flu became one of the first truly global pandemics spread by modern rail and steamship networks. Industrial productivity dropped in major economies as worker absenteeism increased, showing how quickly a disease could move through an increasingly connected world. Then came the 1918 Spanish flu. It infected roughly 1/3 of the global population and killed tens of millions worldwide. Businesses closed, industrial output fell, and economies already weakened by World War I faced additional strain. Many estimates suggest GDP in some countries fell by as much as 6 to 8% during the peak of the outbreak. But no modern event had a larger economic impact than COVID-19. At the start of 2020, the global economy was stable. In the United States, unemployment was near 3.5%, and markets were at record highs. Then, the virus began spreading globally. Factories in China shut down first, disrupting global supply chains. As the virus spread to Europe and the United States, lockdowns followed. By March 2020, entire sectors of the economy stopped at once. Air travel collapsed, restaurants closed, entertainment venues shut down, global mobility froze. Financial markets reacted sharply. The S&P 500 fell nearly 34% in just over a month. U.S. oil prices, specifically West Texas Intermediate crude, briefly turned negative for the first time in history as demand collapsed and storage capacity rapidly filled up. In April 2020 alone, the United States lost over 20 million jobs, pushing unemployment to levels not seen since the Great Depression. Globally, the World Bank estimated the economy contracted by 5.2% in 2020, the worst recession since World War II. Governments responded with massive intervention. Trillions of dollars in stimulus programs, emergency loans, unemployment support, and central bank liquidity injections were deployed to stabilize economies and prevent financial collapse. The response worked in preventing a depression, but the economic effects lasted far beyond lockdowns. Government debt rose sharply worldwide. Supply chains remained unstable for years. Inflation surged as demand returned faster than production. And labor markets shifted, with remote work and industry changes reshaping how economies function. COVID also left structural changes, from commercial real estate declines to accelerated digital commerce. If another major outbreak occurred now, with higher debt levels, persistent inflation pressures, and already fragile supply chains, would the global economy have the same ability to respond? Because history suggests pandemics are not one-off shocks. They are recurring events that repeatedly reshape economies, and leaves us wondering how prepared the system is when the next one arrives.